So Friday, July 31st, the total active cases was 920, which is 64 less cases than last week at this time. Recovered is 2,319, which is 519 more recovered than last week. Our total tested is 16,758, which is last week we tested 2,024. Our negative total count is 13,141. So 1,797 negatives last week, 330 pending, which is 241 less pending than last week. And there's 49 deaths, which is 14 deaths over the last week. And the deaths, we have a report from Ector County, and they've updated the website with additional information related to the deaths. So the data will be presented where it shows, if you look at it, it shows total deaths at 49, 39 of them were at the hospital, 6 of them were at a nursing home, 3 were at a private residence, and 1 was out of Ector County. And all the deaths reflecting the number for Ector County are only Ector County residents. If the death didn't occur in one of the hospitals, then it would be from the nursing home or a private residence or an out of Ector County resident while he's out of town. Here's a breakdown for last week's deaths. On July 27th through the 31st, a 65-year-old male passed away at his home. 54-year-old male passed away out of Ector County. 75-year-old male, 91-year-old male, 52-year-old female, 87-year-old female, 92-year-old female, all passed away during that time. And if you'll go to our website, they've updated it, and by 5:30 every day, they've added graphs and breakdowns to show you the age, the gender, and all of that of the deaths due to COVID. So if you'll just go visit that website each day, and we can discuss it at each Zoom, the data that's current on the website. So that would be the report from the health department today, Trevor.
Thank you, Eddie. Appreciate that. Russell, you want to go ahead and with the MTH number, sir?
Good afternoon, everybody. Here at a medical center, we have had 1,111 people test positive. So that's all ones, 1 positives. Currently, we have 33 COVID positives in-house. That breakdown is 12 patients on 7 Central, 10 patients on 8 Central, 11 in CCU. 6 of those are on the ventilator. The patient list includes 2 from Sienna Nursing Home and Rehab, 1 from Focus Care of Odessa, 2 from Andrews, 1 from Monahans, 1 from Stanton, 2 from Pecos, and 1 from Kermit. And we have, since Friday, we have unfortunately had 5 deaths since Friday, 2 on Friday, 1 on Saturday, 1 on Sunday, and then 1 today. 4,025 people have tested negative. We currently have 45 tests pending for a grand total of 5,181 total tests performed at Medical Center. And with that, I'll turn it over to Kristen if she has anything.
I don't have anything, Russell. Thank you.
Drs. Benton, Dr. Davenport, do you guys have anything?
Nothing new to add at this point.
All right. Stacy, you are there on the phone. Do you have the ORMC numbers?
I do, Trevor. Thank you. Odessa Regional has tested 1,899 individuals. We've had 337 of those be positive, 1,556 negative, and currently only have 6 who are pending. We have 13 patients currently in-house. 10 of those are in ICU, 3 are on med-surg, and 7 of the ICU patients are on ventilators. We have only 1 patient from out of area currently of those 13. That patient's from Andrews. We did also have 2 deaths over the weekend. Both of those were from outside Ector County. We had 1 discharge and 4 new admissions over the weekend. That's all that I have, Trevor.
All right, thank you, Stacy. Let's go ahead and get started with media. And looks like first up is Mike Merlot, Odessa American.
Hi, Trevor. Yeah, I had a question about for the hospitals. I know that y'all have said you had surge plans for when schools open up and things like that. Is there any update on the plan with schooling? Have y'all been in contact with Scott Murray? Will students get tested or anything like that?
I can tell you that we've been in touch with Scott and with Odessa College and UTPB, with all the education entities in town, just to talk about the hospital's role in assisting them when somebody or a group gets sick or comes up sick, and how to we're going to communicate with each other and how that's going to work. Mike, just very high level talks about that. But I think as far as the school district concerned, they have a pretty good plan in-house with their own nurses on how they're going to handle that until it gets higher, when it requires our assistance.
Okay, thank you. And ORMC, is it similar deal there?
Yes, we're all part of the same meeting, so we all participate in that meeting as a group. So it's the very same, Mike.
Okay, thank you. And then also, Stacy, I got the press release about the Women's Center renovations. Is there any, I guess, similar precautions with the COVID-19 for the other parts of the hospital would go into that Women's Center, I suppose?
Absolutely. Anytime a hospital does any type of renovation or construction project, infection control is a top priority. And so we have that plan laid out to ensure the safety of the patients outside of that construction area, to make sure that they are safe. So that's a major component anytime we do a project like this.
Okay, thank you, Stacy. And for Eddie, you said one of the folks who had passed away last week did so at home. I was just wondering how that process works. Was that someone who was in the hospital previously, or is that someone who just passed away at home?
I don't have that information, Michael. I do know that it's a little complicated and difficult finding out when somebody passes away at home that it was due to COVID. So it may be a little delayed getting reported that they passed away from COVID at home. But I can research and see if that patient was formerly hospitalized for COVID and then released to their home.
Okay, and can you go through a little bit of that process of how someone's, how their information comes up as COVID positive if they are found in their home?
Dr. Granton, do you have that information?
I'm not sure exactly the question, Mike, but every positive test is reported to the health department, and then patients are followed through the health department. And perhaps that's how the contact was made. I'm not sure on this particular case.
Yeah, okay. I guess part of the question is, has anyone, passed away at home, and then I guess maybe the family didn't think they had COVID and then it turns out they did, or any worry about, I guess, misclassification of folks who pass away at home?
I'm not aware of such a scenario that you propose.
Okay, all right.
Yeah,
Well,
I don't know that I've heard of it either.
What was that?
No, I'm not aware of any of that happening either.
Okay. I appreciate it. That's all I have today, so thank you all.
Thank you, Mike. Let's go next. I've got, looks like it is Scott.
Hey, everybody. Afternoon. Eddie, I appreciate you going over the numbers from Friday. We're just curious why we can't get those numbers in a more timely fashion when they came out on Thursday.
Let me get this off mute. Okay, those numbers came out, I guess, I don't understand your question.
The numbers came out Thursday night, and we noticed that in the count, 7 people had died over 2.5 days, but yet there was no information about those 7 deaths. And then when we talked to the health department director, she tells us she doesn't have time to take a few minutes to email the media when the hospitals seem to have time and the Midland PIO seems to have time. And the health department seems to have a whole day on Wednesday that it can take off from work because they didn't think ahead to get a parking space somewhere else and hoof it to work when the president was in town. They're taking a whole day off during a pandemic. So I still don't understand why we're having communication issues with the health department. I thought we had worked all this out, but yet it still happens. And I'm curious to know, as a county commissioner who's in charge of the health department, why that still continues.
Well, the information was originally set for 3 o'clock, and they moved it to Monday, Wednesday, Friday. And all of this is due to the difficulties in gathering information and making the reports available. So we hired more people, flooded the thing with staff, and the numbers just keep rising, and the information keeps getting harder and harder to get. There's more and more people doing testing. All of this to say, they changed the reporting period to 5:30 every day. So the health department feels that 1 report is sufficient at 5:30 every day.
But the report is incomplete. The report is missing major information.
Such as the
When 7 people
information that
died, you went over it this afternoon. The ages of the people who died, where they died, none of that information was included Thursday afternoon.
yeah, they didn't have it all. I was on the phone to them. They didn't have that information Thursday afternoon.
So we had to go get it, Eddie. Once they have it, why don't they send it out? Randy's excuse was, I don't have time to email the media.
I don't believe it was intended the way that it was reported. It wasn't that she didn't have time to email the media. It was that the media is emailed at 5:30 every day with the information that we had.
But it's incomplete, like I said. And she did tell us they don't have time to email the media about deaths. Then she wanted to walk it back. There wasn't an intention mistake. It's what she said.
I'm telling you, my opinion, because I was at the health department this week, that it wasn't, we don't have time to take care of them. It was that we have a scheduled information going to be put out 5:30 every day, and we're going to stay with that. I mean, trust me, man, we're trying to keep up here.
I get it. I'm not saying we don't appreciate the 5:30 information dump. What we're saying is, hopefully the health department understands that if 7 people, which was a record in either county, died over 2.5 days, that they will include the basic information that the hospital gives us, that Midland County gives us. I mean, nobody's busier than anybody else on this call or in the next door county. So, if you can take a whole day off because the president's in town, then surely you can take a minute to email the media the information or include it in the 5:30 dump of pertinent information. It wasn't there. We had to go get it.
Isn't it there on the website today?
That was Thursday, Eddie. It came out Thursday.
I understand.
This is
I
5
understand.
days later. I don't care about
I
today.
understand. But I'm pointing to the fact that I believe we corrected that issue, and it's on the website.
Okay, but why didn't it come out originally? Why are we still having communication issues and information issues?
We're working through the process, Scott.
And I guess it's not able to be fixed. It's 4 months in, Eddie. We can't get this
I
down.
understand. And, you know, I tried to explain that we've dumped a whole lot of people on them. And so they've got more than just
I
routine
get all
stuff
that.
going on.
I would
Now
just
they've
think
got to
if
train.
7 people die over a 72-hour period, that would be a flag that we need to include information about those people, that it would be a courtesy to give us the information about those 7 people. That's all I have. Thank you.
Thank you, Scott. Danny, you there?
I'm right here.
All right, go for it.
I have a couple of questions for the doctors. Parochial schools, do they reach out to y'all for advice on a safety plan for their schools going back?
I personally haven't had communication with them.
Or do you know if they have another set of rules that they have to follow other than public school, since they are parochial private schools? Or do they have to come up with a safety plan and send it to the state?
I do not know if they have different rules to follow, but I would suspect that the general recommendation from CDC is that schools communicate with local health authority and with the health department.
So the parochial schools haven't reached out to y'all? So the parochial schools haven't reached out to y'all?
Not to me personally. I'm not sure if they've reached out to the health department or not.
Have they, Eddie? Have parochial schools reached out to you?
They have not to me, no, sir.
Okay. My other question, on Michael's question about when someone that is suspected of dying of COVID-19 at home, do y'all request an autopsy? Anyone? The medical staff?
So the medical examiner is the one that informs us that the patient was positive with COVID once they die at home. I don't believe a autopsy is requested to see if they died of COVID.
Okay. And I guess that's all of my questions for today. Thank you.
All right, thank you, Danny. Up next, let's see. I think that's pretty much everybody. Does anybody else have anything before we go and be back on Wednesday? No? All right, Russell, you want to close this out then?
Yes, sir. Romans 15:13 says, "May the God of hope fill you with all the joy and peace as you trust in him, so you may find overflow with hope by the Spirit, power of the Holy Spirit." Have a good afternoon, everybody.
See you on Wednesday.